Hello, everyone. So today I want to talk about treating high cholesterol, specifically with a medication, class of medication called statins. And this is because many people have a lot of questions about it, and it's a decision that comes with uncertainty and mixed messages, but it can have a huge impact on long-term health. I'm Dr. Lola Ashaye. I'm a board certified family and lifestyle medicine doctor and owner of In Touch Primary Care at Sugarland. So, just a few days ago, I had a patient that was at moderate risk of heart disease. And when I recommended a statin, they immediately declined. I mean, they've heard about the muscle aches. Maybe they were concerned about dementia. They were worried about, having to take something long term. And honestly, that reaction is very common. In my practice, I generally try to take help people take as little medication as possible. And starting a medication is rarely anyone's favorite thing to do. So there's always some hesitation. That's completely normal. But with certain medications like statins, the hesitation tends to be much stronger. So after that happened, I stepped back and I thought, if this were me or a loved one, how would I want to approach this decision? And I wanted to help people have the best available evidence to try to make an informed decision about whether or not this is a good idea for you. So I'm going to break it down. Okay. So statins are a group of medications that typically first line for treatment for high cholesterol. And I'll explain why in a few minutes. So high cholesterol is very common, right? The tricky part about high cholesterol is you can't feel it. The other thing that is kind of, that makes it more complicated with it is you don't feel it, and then it takes decades, years to cause problems. So it's very easy to ignore, right? The only way you'll know whether your cholesterol is high is if you check. So first you have to be proactive and check your blood work. Now someone may say, oh, your cholesterol is high, but you feel fine. And then, on top of that, nothing is happening. Everything seems fine. The problem is when high cholesterol is left untreated, it's quietly damaging arteries, increasing the risk of serious conditions like heart attacks, strokes, and other forms of heart disease. So it builds silently and oftentimes it strikes suddenly. And it can really be very disruptive because when a person has a heart attack or a stroke, it really changes their lives and the lives of those around them. So high cholesterol, like I said, identified through blood work. The blood work typically has several values, right? It will tell you your total cholesterol, your good cholesterol, which is the HDL, your bad cholesterol, which is the LDL. There's also non-HDL cholesterol and a type of fat called triglycerides. LDL, which is the bad cholesterol, plays a central role in development of heart disease. And we know this because when people have familial hypercholesterolemia, which is a genetic condition where the LDL is very high from a young age, even when they don't smoke, they don't have diabetes, they're otherwise healthy, these people with high LDLs develop heart disease early. So we know that LDL plays a central role in heart disease, right? Now, there are other numbers there, right? Your total cholesterol, the cholesterol ratios, those are helpful, but they don't replace LDL or overall risk assessments. And so that's why the guidelines now focus on your overall cardiovascular risk, not just one number. So it's not just about your cholesterol, the cholesterol numbers alone don't tell the full story. We still have to take other things into consideration, like your age, your blood pressure, whether or not you have diabetes, do you smoke, your family history. So there are actually validated risk calculators that we use as doctors to estimate your overall heart risk, heart disease risk. And that helps us guide treatments. So it's important to remember though that obviously, these risks change, right? Because you get older, so that is a risk that would change. Your family history could change. Your health state could change if you develop or reverse certain conditions. So the risk is something that needs to be reassessed periodically, and it's this overall risk that would determine whether or not it's a good idea to start taking statins to lower your cholesterol, or how much lower we need your cholesterol to be. So I hope that makes sense. So it's not just about the cholesterol, but we are trying to lower the cholesterol when we use statins, but it's based on your overall health risk. Okay, so now what do statins actually do? So statins, like I said, they're a group of medications that help lower cholesterol, and they lower bad cholesterol, but that's not their only benefit. They actually also reduce inflammation in the blood vessels, and they stabilize plaque so that it's less likely to rupture and cause heart disease and strokes, right? So it's by doing these things, lowering your cholesterol, reducing, inflammation, stabilizing plaques, that they lower the risk of heart attacks and strokes, and they reduce the overall risk of dying for people who have these high risks, right? So there's strong evidence supporting this. Most experts agree statins work. There's very little debate about whether or not they work. So why do people still have concerns? Well, because even when a treatment is effective, there's still important things to consider. The first thing is statins don't reduce risk to zero, right? They meaningfully lower it, but not to zero. So, for example, for every 39-point reduction in your LDL, so for instance, if your LDL is 170 and you reduce it to by 40 points, so to 130, right? That will reduce a risk of you having a heart event or cardiovascular event by about 22%. And it also reduces the risk of death by about 10%. So for every 100 people, so if 100 people at similar risk as taking a statin, we're going to prevent 20 to 25 of them from having a serious event like a heart attack or stroke. So not everybody, but a good number of people, right? So it doesn't eliminate risk entirely. It doesn't guarantee that a person is not going to have serious events, but it does lower the risk, right? And this is why lifestyle still matters. Taking a statin doesn't cancel out smoking, inactivity, poor nutrition, chronic stress, and other things that affect cardiovascular risk. So at the end of the day, to meaningfully lower cardiovascular risk, lifestyle changes need to be placed alongside with medications like statins, because risk is reduced through multiple pathways, through your blood pressure, through insulin resistance, through inflammation, through weight, not just cholesterol. So it's important to know that statins are additive, they're not a substitute for lifestyle change. So the other thing that to consider, in addition to we know it works, we know it reduces your risk to some extent, not to zero, but people are concerned, and this is something that comes up in my conversations when I talk to people about statins, that the treatment thresholds have changed over time. And some people worry that this is driven by pharmaceutical companies, and that, we just want to get people on statins, right? And it's important to understand that research changes all the time, right? Research improves. We get better at identifying things. We get better identifying who truly benefits from treatment and how much benefit there is. So the recommendations are going to evolve, and that happens as science evolves. So it's not about treating everyone, it's about being more precise about prevention. So I'm sure there are people that are still going to have questions around this, but just understanding that things will always change, and that's expected in medicine. Okay, so the other thing I want to bring up about statins is it's not a quick fix. So now when we're talking about trying to prevent a heart attack, so if someone has never had a heart attack or stroke before, studies show that it takes up to 2.5 years of consistent statin use to prevent one heart attack. That matters because statins are actually intended for long-term use. it also means that it may not make sense for everyone at every stage of life. So if life expectancy is limited or priorities change, that's something that needs to be considered. And that's why statins should never be just started automatically or continued indefinitely. It needs to be reassessed from time to time. So, um, so you may be wondering, and there are alternatives. Can I take something else that doesn't have much concern around it? And yes, there are alternatives to statins. The issue is um, they have been shown to lower cholesterol numbers, but most of these alternatives don't have the same evidence showing that they actually reduce inflammation, stabilize plaque, or even prevent heart disease and strokes. So it's one thing for something to lower a number. It's another thing for that to actually translate into outcomes, right? Into actual real outcomes like fewer strokes, longer life, fewer heart attacks. And statins have strong outcome data. A lot of the non-statin therapies don't have quite the same evidence showing the strong outcome data. And that's why statins are still the first line in treatment for high cholesterol for many people. The final point I want to make about statins is, another question I get is some women have asked because early studies included more men than women, which understandably will raise the question, does it work for women just as well? But with later analysis, we've seen that women with elevated cardiovascular risk benefit from statins as well, with meaningful reductions in heart attacks and strokes as well. So it appears that the risk matters more than the gender alone. So those are some of the things I hear when it comes to lowering cholesterol with a statin. So how do you decide if taking a statin makes sense for you, right? Because everybody's risk is different. So here are some step-by-step questions that I hope are helpful and can help you have a meaningful conversation with your doctor, right? So the first one is ask your doctor, what's my actual cardiovascular risk? So not just your cholesterol, but your overall cardiovascular risk. So as doctors, we can calculate your 10-year cardiovascular risk, your lifelong cardiovascular risk using validated tools. And it factors, things like your age, your blood pressure, your cholesterol, of course, diabetes, smoking, and more. And this risk can be helpful and should be revisited over time because risk changes, but it can help you know, are you at low risk? Are you at moderate risk? Are you at high risk? So if you are at a high risk, right, of a cardiovascular event, some things that can put you at a high risk is if you have like multiple metabolic conditions like diabetes, high blood pressure, in addition to high cholesterol, if you smoke, if you've had a prior heart attack, if you've had a prior stroke, if you've had a stent placed. So some of these things are considered high risk to have an event, right? So if you are the high risk, the benefits of statins almost always outweigh the risk. And most um, after, usually this is not a group that would hesitate as much because after you've experienced a serious health event, most people are motivated to do whatever it takes to prevent another one. So the high risk people usually is not as hard to, explain the need for the statin. Now, the people in the gray zone, and this is where many people fall in, you feel well, your cholesterol is high, your lifestyle could be better, but you're wondering, can I just do this naturally? Do I really need to add a medication? So again, your doctor can help you calculate your exact risk based on the factors we talked about. But you want to know the total risk, right? The overall risk of heart disease. And then things to consider for every reduction, 39-point reduction in your bad cholesterol, if you have moderate risk, it can lower the events of a cardiovascular event by about 20 to 25%, and it can reduce your risk of death by about 10%. So there is some risk reduction that would happen by lowering your cholesterol by about 40 points. Let's say 40 points, right? It's hard to lower your cholesterol by 40 points with lifestyle changes alone. So that's where you need to kind of look at everything and decide if how aggressive you're going to be with your lifestyle, really, and if it's worth it for you to do lifestyle and medication to help you lower that risk in a meaningful way. But you can't just say, I'm going to take a pill and not do lifestyle. They work together. It is possible for you to take the pill and then by poor nutrition, worse, not doing physical activity, gaining weight, all of that, it still won't work because you need everything together to lower your risk of heart problems and strokes. Okay. So okay, so now you kind of maybe have a better idea of, okay, maybe this will actually help. It will lower my risk, right? But then the second question you want to ask your doctor is, what side effects have been proven to be associated with statins? Because that's where people start to, you know, feel like there's a lot of mixed messages around that, right? So you know it could work. The data has shown it works. Now you're concerned about how is it going to affect me. So the most common concern that we hear is muscle aches, right? And clinical trials have been done about this, and it shows that about 27% of people taking statins report muscle pain. But also, about 27% of people taking placebo pill in that study also reports muscle pain. So, in other words, muscle aches are very common in adults, whether you're taking a statin or not. And when they look closer, they found that about 1 in 15 reports of muscle pain in people taking statins was actually caused by the statin itself. So there is a small risk of increased muscle aches, and it does happen. So that's something that you want to, discuss with your doctor. The thing about it that we know it usually happens in the first year. And it can improve with dose adjustment or stopping the medication. The good news is that permanent muscle injury from statins is very rare, and symptoms are almost always reversible. So it can cause muscle aches. Usually, it happens in the first year. It's a small increase in the risk of that happening, and it's usually something that is reversible. Now, the more serious things that people talk about are things like, does it cause diabetes? And statins can increase blood sugar. But what the studies have shown is that it brings diabetes to light a few weeks earlier for people that are already at risk. So, for instance, if you have risk factors for diabetes, and you start a statin, you could be diagnosed with diabetes earlier than if you didn't start a statin by a few weeks. Okay. So, but the thing to remember is statins actually reduce the risk of heart disease and stroke, which are the main causes of complications and death from diabetes. So, yes, it can bring diabetes to light sooner, but it also reduces your complication, the risk of the main thing that we're trying to prevent, which is heart disease and stroke. So those are the, important things that need to be considered, when you are starting a statin. Now, I've also heard other things that people are concerned about, like dementia. Do statins cause dementia? Do they cause cancer? Well, large, high quality studies do not show that statins cause dementia or cancer. And because statins are so widely used, especially in midlife and older adults, it's really easy to associate them with many conditions. And many conditions can develop, later in life. So association does not mean causation. So studies have not shown that statins cause these conditions. Okay. But at the end of the day, anytime we talk about starting a medication, including statins, it's important and it's appropriate to think about the risk. And that's true for every prescription medication. And that's why these decisions should not be rushed or made in isolation. It's important that we separate the risks that are supported by evidence from the concerns that are driven by fear, by rumors, by experiences that can't be reliably validated. So just, talking to your doctor about it can be helpful. You want to ask them about what your personal risk is based on validated tools. You want to talk about the side effects and see, which ones you may be at risk for so that you can do whatever you can to mitigate that. And then third question you want to ask yourself is, am I willing to reassess this over time? So your risk can change. So close follow-up is going to be needed. Medications need to be monitored. They need to be adjusted and reassessed. So if you are starting something, or if you're considering starting something, you want to make sure that you're willing to go through, check in, at least once a year. You want to make sure that your risk is being assessed from time to time. And for example, if someone makes lifestyle changes for 6 to 12 months and their cholesterol lowers significantly and their overall cardiovascular risk drops, they may be able to stop the medication or reduce the dose. So it's important that you do continue to follow up with your doctor to make sure that you should still be taking it. Okay, so we said a lot today, and if you're still listening to this, it's because you care about reducing your risk of heart disease, right? And another question that comes up right along statins is aspirin. So I want you to recommend that you watch my video about should I take a daily aspirin? Because for many people, the answer is not what they expect. So that's another video that'll be helpful if you've learned something about taking a statin. So I think the point here that I think sometimes we don't always realize is that prevention shouldn't be guesswork. It's not a guesswork thing. It can actually be done systematically with the right guidance. And that's why, and it's something that is ongoing. It's not something that it's one and done. So if you are in Texas and you want help understanding your personal risk, I'm going to invite you to schedule a free 15-minute consult to learn more about how we may be able to help. And if this has been helpful for you, please go ahead and like, subscribe, share this with someone that, someone else. It might really make a huge difference for them. It might help clarify questions that they have and help them make a informed decision. So just remember, at the end of the day, statins aren't right for everyone. But for the right person, it can meaningfully reduce the risk of serious life-altering events. So the goal is not always just to avoid medication at all costs. It's to make thoughtful, evidence-based decisions that align with your health goals and your values. So I hope that helps.